Hello, my name is Kayla Hazeltine, and my project proposal is on the implementation of cognitive behavioral therapy to decrease substance abuse. Substance abuse is a rising problem nationwide. In 2005, around 22 million Americans suffered from a drug or alcohol problem, and 95% of these people were unaware of their problem. In Wisconsin, the per capita alcohol consumption rate is 1.3 times higher than the national rate, and heavy drinking among adults is more common in Wisconsin than in the nation as a whole. In Wisconsin, there has also been an increase in the use of prescription drugs for non-medical purposes, which aligns with national trends. Rates of marijuana, other illicit drugs, and non-medical use of pain relievers are highest among young adults ages 18 to 25. The psychiatric mental health nurse practitioner plays an important role in treating individuals that suffer from substance abuse and addiction. Cognitive behavioral therapy is a type of psychotherapy that encourages patients and providers to work together to identify harmful thought patterns and seek alternate thinking in order to treat mental health issues, including addiction and substance abuse. Negative thinking patterns are addressed, such as powerful, destructive thoughts that contribute to substance abuse and the sense of powerlessness and lack of control over the addiction behavior. Several studies performed support the use of cognitive behavioral therapy in treating substance abuse disorders in adults. Hunter et al. Performed a randomized controlled trial to determine if group cognitive behavioral therapy would be an effective treatment for depression and substance abuse. Study findings showed at 3 months post-baseline, both groups reported significantly fewer days of problem substance use. Clients in the intervention condition also significantly reduced the number of drinks per drinking day, where the control condition did not. Data from baseline to 6 months showed improvement in days of problem substance use for the intervention group. Kyluk et al. Completed a randomized controlled trial to determine if a computer-based cognitive behavioral therapy is effective in treating those with an alcohol use disorder. Study findings showed an overall increase in abstinence during the 8-week treatment period among the sample as a whole. Contrasting data comparing the groups showed a more rapid increase in days abstinent across time in the computer-based cognitive behavioral therapy group. In addition, the percentage of heavy drinking days per week decreased in the sample as a whole and decreased more rapidly in the intervention group compared to treatment as usual. There was a significantly higher rate of percentage of subjects with no heavy drinking days in the intervention group compared to the treatment as usual group. Carroll et al. Performed a randomized controlled trial to determine if computer-based cognitive behavioral therapy would be an effective treatment for cocaine-dependent individuals maintained on methadone. Study findings showed significantly more participants assigned to the cognitive behavioral therapy group attained 3 or more continuous weeks of abstinence from cocaine within treatment. The cognitive behavioral therapy group submitted more drug-free urine tests as well as cocaine-free specimens. There was a significant overall reduction in the frequency of cocaine use by month from baseline through 6-month follow-up. Overall, the cognitive behavioral therapy group had greater reduction in cocaine use compared with those assigned to treatment as usual. Pettit et al. Performed a randomized controlled trial to determine if cognitive behavioral therapy plus a prize-based contingency management for cocaine dependence was an effective treatment for those suffering from cocaine addiction. Study findings found negative urinalyses increased significantly over time in both groups, with no difference between groups. The percentage of patients achieving 3 weeks of continuous cocaine abstinence did not differ significantly between the treatment groups. At 6 months, cocaine-negative samples were higher in the experimental group, although not statistically significant. Analysis showed a significant decrease in frequency of cocaine use over time, but no difference between groups. The results show that either one of these interventions is appropriate, and cognitive behavioral therapy alone would still be effective without having to add additional funding for prize contingency management. The purpose of this project is to implement cognitive behavioral therapy to meet the following objectives: reduce substance abuse in adults suffering from a substance abuse disorder. Participants will be recruited from Tulare and Madison, Wisconsin. Inclusion criteria include adults seeking outpatient treatment for substance addiction. Participants must be 18 years or older, English-speaking, and diagnosed with substance abuse or addiction by a medical professional. Potential participants will meet with Kayla Hazeltine, myself, and discuss the objectives and steps of the study, and they will receive and sign a written copy of the informed consent and voluntary participation. Participants will then receive instructions for the timeline drug use calendar and a blank calendar so they can begin tracking their drug use for 30 days prior to therapy initiation. This will serve as baseline data. Therapy sessions will be individual sessions and will be flexible as to accommodate the schedules of the participants. The therapy will be 10 weeks long, with participants attending 1-hour sessions twice a week for a total of 20 sessions at the Tulare main campus. Sessions will be led by therapists who are trained and certified in cognitive behavioral therapy. Therapy will consist of topics including long-term goals, identifying troubling situations in life, becoming aware of negative thoughts, and reshaping one's thinking about troubles, situations, and negative thoughts that may be leading to the substance abuse behaviors. Skills will also be taught on how to cope with cravings and how to make behavior changes. Evaluation will include data collection on the frequency of drug use that will be collected using the Timeline Drug Use Calendar. Participants will fill out the Timeline Drug Use Calendar for 30 days prior to therapy initiation, throughout the weeks of therapy, and for the 6 months following therapy. This calendar is simple to use. Participants will receive blank calendars for the month before therapy begins, months for duration of the therapy, and 6 months post-therapy. A single checkmark is to be placed on days that substance use occurs, and on days where there is no substance use, participants simply write 0 in that day. Participants will be asked to mail their calendars to the researcher at the end of each month until 6 months post-therapy. An analysis will then be performed to determine the amount of substance use among the participants and whether the substance use has decreased or not after the therapy and in the 6 months following therapy. The chart shows a proposed timeline for the project which will last approximately 1 year total. The most significant expected change is that participating adults will decrease their substance use shown throughout therapy and through the 6-month follow-up period. Please let me know if you have any questions. Thank you.